night nurse. Is it okay if I do a quick respiratory assessment on you?
Yeah.
Okay, can I get you to verify your name and date of birth?
Yes, Alana Harmon, 12/29/01.
Great. Okay, I'm just gonna ask you a couple questions. Do you have any allergies?
No.
Any history of COPD,
Mm-mm.
lung cancer?
Mm-mm.
Have you had trouble breathing? Any shortness of breath?
Mm-mm.
No difficulty sleeping?
Mm-mm.
Okay. Do you exercise regularly?
Mm-hmm.
How's your diet?
Pretty regular, normal.
Okay. And do you smoke?
No,
And do you drink alcohol?
I do not.
Okay. What is your occupation?
I'm a student.
Okay, so no exposure to any chemicals or irritants.
Mm-mm.
Okay. Are you on any medications like inhaler?
Mm-mm.
Are you on any pain meds?
Nope.
Any antibiotics? Steroids? Perfect. Okay. I'm gonna take a look at your pulse ox. I see your finger. All right. I would note that it's 99, so that is normal. Can I ask you to sit up for me real quick? I'm gonna look at her anterior posterior diameter, and I note that the ratio is 1:2, so that is also within the normal range. I'm gonna inspect her chest. I'm looking at her trachea. I realize it's midline. She's not using any accessory muscles to breathe. I'm gonna take a look at your hands. I'm gonna assess her cap refill. It's less than 3 seconds, so that is normal. I'm looking at her fingers, they're pink. I don't see any clubbing. Her lips and her skin are dry and pink, which is normal. I'm gonna go ahead and take her respiration rate. So I would watch her breathe for a minute, and I would see that it is 16, which is normal. I'm gonna go ahead and palpate your chest, and I'm just gonna feel around the lung fields for any crepitus, which I do not feel. And I'm gonna go ahead and palpate for tactile fremitus. So every time I move my hands, can you say 99 for me?
99, 99, 99, 99.
All right, and I'm gonna note that it was symmetric bilaterally and the vibrations decreased as I moved down. I'm gonna go ahead and percuss her lung fields. Okay, and it was resonant. I'm gonna go ahead and take a listen. Just take a deep breath for me every time I move my stethoscope. Okay, her breath sounds were unlabored and regular, and I heard no abnormal sounds, and I'm gonna go ahead and listen to her voice sounds. So every time I move, just say 99 for me.
99, 99, 99, 99, 99, 99.
All right, it was indistinct and muffled. I did not hear her say 99. All right, so I'm gonna go ahead and ask you to stand up so I can look at the back of your chest. All right, so I'm just gonna inspect, and I see that her spine is straight and her scapula is symmetrical. I'm gonna palpate her chest and note for any crepitus, which I do not feel. And then I'm gonna go ahead and look at her thoracic expansion. So I'm gonna put my hands here and ask you to take a deep breath. Great, and I noticed that my fingers moved 5 centimeters, which isn't within the normal range. And I'm gonna go ahead and palpate for tactile fremitus, so if you can just say 99 again every time I move my hands.
99, 99, 99, 99.
Okay, and I noticed that they were symmetric bilaterally and the vibrations decreased as I moved down. I'm gonna percuss for diaphragmatic excursion, so if you could go ahead and take a deep breath and let it out and hold it. Okay, I'm gonna note this spot here, and if you could go ahead and take a deep breath and hold it. I would note here, and I would take the difference between these two, and it was 3 centimeters, so that is also within the normal range. So I'm gonna go ahead and percuss. notice that is resonant over all the lung fields and dull over bone. And lastly, I'm gonna auscultate the breath sounds. Just take a deep breath every time I move. Great, lung sounds were clear. And I'm gonna auscultate the voice sounds, so if you can just say 99 every time I move.
99, 99, 99, 99, 99, 99.
Okay, so I noticed that they were indistinct and muffled. I did not hear her say 99, so that is normal. And